Now it is my great honor to introduce Dr. Francesco Marino, distinguished medical doctor, homeopath and acupuncturist, longtime director of the Scientific Department of Italian Homeopathic Federation, president of the 74th World Congress of Homeopathic Medicine, and esteemed national teacher and author in the field of integrative medicine. Please welcome.
Thank you very much. Thank you very much. Can you see? Can you hear? Okay. Thank you very much. Good afternoon to everybody, first of all, and a great thank to the organization of the Congress, first of all to Professor Pfeiffer, and also for the very kind support of the team of chairmen and chairwomen. Well, I'd like to introduce you to the pathway, the route, the ratio, and the clinical evidence of homeopathic medicine within the framework of oncology. As you probably know, homeopathy is a medical system which arose between the 18th and the 19th century, thanks to a brilliant German physician, Samuel Hahnemann, who rediscovered and systematized an ancient principle, the principle of similarity, the symbol of analogical thinking, which was the ancient paradigm, the medical paradigm of the ancient cultures and civilizations, from China to Greece, from India to Africa, from Northern America to Native Americans to pre-Columbian populations. And this paradigm, this medical system run through the entire history of medicine. That's why can be considered, by all reasons, a traditional medicine, not by chance. Homeopathy is included into the Department of Traditional and Complementary Medicines of WHO. And in the last 60 years, homeopathy gained an increasing popularity all over the world, so that even WHO recognized homeopathy is the second medical system widespread in the world, together with acupuncture. And you can see the numbers. At the moment, about 600 million consumers and more or less 500,000 physicians in the world. But notwithstanding, homeopathy since the beginning was criticized and rejected by the most conservative part of academic medicine. And the criticism for the last 20 to 200 years were always the same. Which means a pre-scientific methodology, implausible because an unknown mechanism of action, a placebo effect, lack of evidence, and low-quality research. But is all that really true, my friends? Let's have a look. From early 90s in the last centuries, evidence-based medicine became the mainstream medical paradigm, which is supposed to be an independent tool to improve the quality research, meaning not a golden calf, neither a club to discriminate different opinions, but in reality, it was elaborated in order to stem the rising tide of the complementary and alternative medicines, because the conservative, the skeptics considered complementary and alternative medicine as lacking of research, evidence, and particularly in homeopathy. But as a kind of historical revenge, what happened? Just from the beginning of EBM, the homeopathic production in research increased both at a quantitative and a qualitative level. In fact, in fact, if in 2014 the RCT published were 204, 10 years later they tripled. That's why several databases were created in order to collect all this evidence. And that's why we're supposed to talk about evidence-based homeopathy. And this is the last database, an Italian open access database, which is part of the official documentation of the top homeopathic organization, medical organization. It collects only studies published and indexed from 1949 up to now, contains both positive and negative studies. And there's a reference for each study from the main electronic databases with a link for each reference in order to access the full or the abstract text. And these are the numbers. At the moment, we contain 1,200, more than 1,200 evidence divided in 9 different branches, from veterinary to agrohomeopathy, meta-analysis, RCT, and so on. So let's have a look now at the epidemiological trend of oncology in Italy and in Europe. In Italy, in the last 2 decades, there were a 60% increase of tumors, equal to 6.2% of the entire population. Just last year, we had almost 400,000 new cases, with a huge impact on our national budget. Just for the anti-tumoral drugs, we spent almost 5 billion euros. And the situation in Europe is not any different. So that European Committee decided to promote, to recommend, to have health policies in order to implement patient-centered and holistic policies for quality of life. And homeopathy is a part of this framework. We know in the last 40 years, a number of progress have been made about early diagnosis, prevention, therapies, but still we have many unsolved problems, issues to be faced. That's why a number of oncologists, especially in the last 25 years, have been looking for innovative solutions, such as the traditional and complementary medicine, homeopathy included, also because these medical systems are requested from the patients. And you know, the patient's values and preferences is the third pillar of EBM. And these choices are not only to control, to prevent side and adverse effects, but especially to potentiate immunity. So from this integration, from this cultural osmosis, a bridge between different traditional medicine and biomedicine is going to emerge. Sorry. Such a scenario became possible thanks to a changed attitude of oncologists who turned from the initial distrust and hostility into curiosity and interest, finally also clinical trials. In fact, in the last 20 years, an amount of evidence, positive evidence, has been collected, highlighting significant savings on health budgets. This is a new model of precision medicine, because it's tailored on the constitution of the patient. So, what can homeopathy do for oncology? What kind of strategy or what kind of role can play? At the moment, we have 2 kind of different strategies. Homeopathy as an adjunctive treatment, meaning a constitutional, personal medicine in addition to conventional therapy, or a complementary treatment, meaning asymptomatic, in order to control the side effects of the conventional therapies. As concerns the scientific production of evidence, we have to distinguish 2 phases. An initial phase, more exploratory, I mean observational studies in order to explore, to investigate use and popularity of homeopathy. And a second phase, clinical, due to changed attitude of oncologists in light of results, low cost and reduced toxicity of homeopathy. And now let's have a quick overlook about some of these studies. In 2005, 73% of Italian women with breast cancer turned to complementary and alternative medicine, homeopathy included. In 2014, a census about European centers providing integrative oncology service was carried out. And 123 European centers were contracted, and 47% of them met inclusion criteria. And homeopathy was the second choice. And in 2021, in Bologna, at Sarcoma Center, 469 patients, oncological patients, were asked about their preferences within 15 months. 82% used complementary medicine in conjunction with the chemo, and homeopathy was the third choice, and 75% reported high benefits. Most of them were young women of high social cultural status, and their choice were communicated for the first time, both to oncologists and GPs. In 2021, in Strasbourg, Dr. Jean-Louis Bagot in Strasbourg carried out this survey, and he demonstrated in 12 hours the number of patients who turned to homeopathy doubled. And 164 patients out of 535 used homeopathy as a complementary treatment, and 83% were really satisfied. And in 76% of cases, homeopathy was prescribed by doctors, and both GPs and oncologists were informed. So this demonstrates the environment was changing. And the best symptoms improved were fatigue, pain, nausea, soreness, and diarrhea. So, in conclusion, Bagot said the perception of oncologists about the use of homeopathy in oncology really changed, as 10% of them prescribe homeopathy, 36 recommends, and 54 considers homeopathy potentially useful. And now, let's go to homeopathy as an adjunctive treatment. We are honored to have here Professor Frass, who carried out 3 amazing studies. The first one was an observational study in 2009 at Vienna, University of Vienna, 90 patients with a different kind of tumors, and the outcome was the quality of life evaluated in 24 months. And the results was significantly improved after homeopathic adjunctive treatment. And after the 4th visit, 80% of the patients reported improvement of the general condition. Based on this study, Professor Frass carried out a pragmatic randomized control trial on 410 patients divided in homeopathy group versus standard therapy. And the outcomes were the global health status and the subjective well-being in 3 times, monitored by a validated questionnaire. And the homeopathy group, also in this case, reported highly significant improvement of both on outcomes between the first and the 3rd visit compared to the control group. And finally, the pearl. The pragmatic randomized control trial versus placebo, double-blind, 3-arm, multicentric, phase 3 on 150 patients with non-small cells lung cancer, stage 4. The quality of life was evaluated in 2 randomized groups versus placebo, and in survival in 3 groups. The homeopathy group reported highly significant improvements after 9 and 18 weeks, as concerns both outcomes. And this study provoked a strong opposition of skeptics, so that the editor was forced to withdraw this study. But Professor Frass held along, and he promoted a lawsuit versus a defamation process. And after 4 years, very expensive, very tiring, he won. And the editor republished the study as it met all the scientific criteria. This is a study conducted at the University of Bern on 94 pediatric patients, and results were so satisfactory that finally University of Bern welcomed homeopathy into the pediatric hospital. This is a very interesting experience in India, Calcutta. This is a family, Banerjee family, who founded a homeopathic research foundation. In 15 years, they treated 22,000 patients with different cancers by their protocols based on highly diluted medicines, specific for each kind of tumor. And this protocol attracted the interest of National Cancer Institute, which included this protocol into the best case serial program. 941 women with breast cancer reported a complete regression in 19% of cases and amelioration in 21% with a long follow-up. And 4 out of 14 patients with cancer of the esophagus and lung met all the criteria required, and the diagnosis before and after the treatment was confirmed as the response was positive, so that the NIH conclusion was the results of the review were deemed to be sufficient to warrant NCI-initiated prospective research follow-up in the form of an observational study. This is a study, a preclinical research in collaboration between the Banerjee Foundation and the Anderson Cancer Center from Houston. 15 patients with glioblastoma reported a complete regression in 6 cases due to cell apoptosis for telomere erosion phenomena and mitotic catastrophe events. Another preclinical research between National Cancer Institute and Anderson Cancer Center, 4 highly diluted medicines were tested versus 2 human breast adenocarcinoma cell lines. And the results was positive because the cytotoxic effects were due to altered expression of cell cycle regulatory proteins, which provokes a cycle delay or rest, as well as induction of cell death by activation of apoptosis. And carcinosinum and phytolacca showed the same activity of paclitaxel, the most prescribed chemotherapy in the breast cancer. In conclusion, I finish. Homeopathy treats the patients as oncology treats mainly the disease. Both they can arrive to a successful treatment because homeopathy improves the patient's compliance, the clinical response, and the patient's clinical symptomatology. Moreover, reduces side and adverse effects, hospitalization times, costs, and working days lost. And finally, met the 3 pillars of ABM: expertise, evidence, and patient choices. That's why we need to invest in research and professional training and studies. More studies are required in order to improve the research in homeopathy. So, my friend, let me say as a conclusion, as Albert Einstein said in 1938 when received the Nobel Prize from the hands of the King of Sweden, it's easier to break the links of an atom than the chains of prejudice. Thank you very much.
Thank you very much for your insightful lecture.